you have shoulder pain that either won't go away or only is getting mildly better depending on what you do. So what do? You go to the doctor. And what do they tell you? That you have a rotator cuff tear. Now the problem is that you've only been given about a fourth of a full diagnosis. And let's say you end up in my office. Now the first thing I am going to ask you is, which rotator cuff did you tear? And you say, my left one. Okay, which rotator cuff in your left shoulder did you tear? So you actually have 4 rotator cuff muscles in each shoulder. So when I'm asking which rotator cuff muscle you've torn, I'm trying to understand which muscle has sustained the injury so that I can give you a proper treatment. Now the second question I'm going to ask is, to what degree have you torn said rotator cuff muscle? And the third question is going to be, how did you tear it? Now, if you don't have an answer for all of these questions, that's okay. That's exactly what we're going through today. I want to help you get a full diagnosis and put together a treatment plan so that you can rehab from that injury and get back full range of motion and mobility without the use of pharmaceuticals daily. Welcome to Dialectic Healing, where we discuss a fusion of physical and mental therapies so that you can obtain and maintain your healthiest self. Quick anatomy lesson. Your shoulder girdle is made up of 4 bones: your clavicle, or your collarbone, your scapula, or your shoulder blade, and your humerus. Now, the rotator cuff muscles are the 4 muscles that actually all attach to the shoulder blade and insert around the head of the humerus, hence creating a little cuff. Now, all 4 of these have different functions, so that's why it's really important in the diagnostic to understand which one has been injured. The supraspinatus is in charge of abduction or abduction, which is an outward motion like this. Your infraspinatus and teres minor are external rotators, which will bring your arm out away from your bodies like this. And your subscapularis, which is in the armpit, is the strongest and biggest of all of them, and that is your internal rotator. Now, it's important to understand how that joint is put together between the muscles, tendons, and ligaments, and understand how each of those gain strength and what their abilities are. Now, we gain strength in the same order that we lose strength. Muscles first, then tendons, then ligaments. So the muscles have the highest amount of blood supply. They will gain strength first. So all of that resistance training, lifting weights, and daily activity, your muscles will gain strength first and quickly. Your tendons, however, need a little bit more time. Now, though the tendons will attach the muscle to bone. And with resistance and with that continued muscle activation, there will be that resistance and tensile strength that the tendons know they need to continue to build. But it takes them longer because they have less of a blood supply, they have a higher amount of collagen, and so building that tensile strength takes them a little bit longer. And finally, you have the ligaments. Now, those attach bone to bone only. And those are kind of the deeper ones, the more of the joint capsule. And within that joint capsule, the ligaments have the least amount of blood supply and the most amount of collagen. So those will take the longest to strengthen because of the nature of the way they're built. Now, let's say you stop working out and stop activity for whatever reason, especially due to this injury. You might stop working out. Now, that's not recommended. You don't use it, you lose it. Motion is lotion, especially with your joints. But let's say you do stop working out as intensely. Now, the muscles are actually going to atrophy and get weaker first. then the tendons, then the ligaments. So same order. You gain strength, muscle, tendon, ligament. You lose strength, muscle, tendon, ligament. Understanding that muscle, tendon, ligament strengthening sequence will help in not only injury prevention, but also in rehabilitation. All right, so let's go back to the first question that I'm going to ask you. Which rotator cuff muscle have you torn? Now, if they did not do an MRI or a CT scan on your shoulder, then they don't know and haven't told you. But there are some simple muscle testing that can be done, even just in a normal physical therapist office or a massage therapist office. Like I said, your supraspinatus is the one that does abduction. So if you're trying to do this motion and you're experiencing pain here, especially if they do the drop test with your thumb down and put a little bit of pressure, if that elicits pain, typically that's going to give you a positive that you have torn your supraspinatus. In the same direction, if you try to externally rotate and someone puts a little bit of pressure and that causes pain in the back of your shoulder, you may have a tear somewhere in your infraspinatus or your teres minor. And finally, if you try to internally rotate with resistance and there is pain kind of on the anterior part, the supraspinatus might be compromised. Now, the final question that you want to answer is, to what degree and severity have you torn the rotator cuff muscle? Now, these are classified by 3 different degrees. The first one being the most mild, very minor inflammation, maybe just a little bit of fraying in the tendon. The second degree is more of a partial tear, but it's still intact. So you'll be able to do the motion, but you experience pain. And then you have the third degree, which is considered a full thickness tear. And that might be the point where either surgical intervention is necessary in order to repair that muscle completely. It's important to combine a physical examination with some imaging and also those muscle testing diagnostic tests that I went through earlier, to just get a full picture of what's going on with which rotator cuff and to what degree you've torn it. So now that you have a full diagnosis, meaning you know which rotator cuff you've torn, you know to what degree you've torn it and how you did it, now it's time to talk about the rehabilitation that you're going to need to undergo in order to get fully healed, so that your pain goes away and you have full function and mobility of your shoulder again. Now, there are great options between physical therapy, massage therapy, and acupuncture. Now, physical therapy absolutely is going to immediately put you through exercises, strengthening exercises specifically, and stretches to help you maintain that mobility and flexibility while you rehab. And they may even do that specifically, especially if the reason you tore it was because of overuse. They're going to work on your posture and work on that overuse mechanism and change some things up so that it doesn't happen again, or it doesn't happen to the other shoulder. Massage therapist is really helpful in this area because they're going to increase the blood circulation in that area, relax all of the other muscles that are kind of overtaking that pressure to try and help still give you some motion. So a lot of other muscles surrounding the injury can get super tight. So massage therapy is going to really help move that inflammation out of there because of the injury, bring new blood in and increase that circulation, which is your healing power, and also help maintain that flexibility and mobility and ease the tension off the other surrounding muscle tissue. Now, acupuncture is also super beneficial in this instance because it can bring in things like cupping and electrostimulation and it can really encourage your body's natural mechanism to want to heal itself. Moxa is one of the best ways to help with increasing the circulation, decreasing the inflammation that's there, and really triggering your body's ability to heal itself. So by utilizing these three, honestly, sometimes I say overlap it. I don't think a one size fits all is the way to go. I think utilizing the exercises and stretches that a PT will give you with the mobility, strength, and relaxation and movement that a massage therapist is going to give you, plus utilizing some of the holistic natural mechanisms to encourage your body to heal itself, all of these three combined are just a fantastic way to really see lasting results and quick results if you're starting to utilize all of these on a weekly basis. I hope that this information was helpful for you. And if you are still struggling with this pain and it hasn't been improving as quickly as you would like to see, then check out my 30-day pain-free jumpstart guide. There are a lot of things in there, especially diet recommendations, that will really help to increase that healing faster, on top of all these other things that you might be doing. Subscribe and check out some of the other videos I've got on Moxa and acupuncture. I even go through a bunch of different options when it comes to massage therapy, like deep tissue, sports, and injury. Stay tuned for more, and in the meantime, may your pain be relieved.